Have you noticed a bulge or a gap in your belly that no matter how hard you exercise, it continues to stick with you? It may not actually be belly fat. It could be that you're suffering with a diastasis recti. And if so, you are in the right place because today we are going to be discussing what is a diastasis recti, as well as how to know if that's what you're suffering from. And at the end, we'll cover the most commonly what not to do and what you should be doing if you are indeed suffering with a diastasis recti. I'm Dr. Amy, PhD trained orthopedic manual physical therapist, and I believe that movement is life and you deserve both. First off, what is a diastasis recti? It's actually a strengthening of the rectus abdominis, which is one of the 4 abdominal muscles. The rectus abdominis starts up at your sternum, so way up pretty high, and it attaches all the way down to your pubic symphysis. So that's your pubic bone that's way down there. And they're long, strappy muscles that go all the way down. So there's 2 straps, which means in the middle, you can get a bulge. Now, this is most commonly associated with women who are pregnant because obviously as the pregnancy progresses, your abdomen is going to get bigger and those muscles are going to naturally separate to accommodate the size of the fetus. However, my friends, it can still happen to men, and it is actually very common in athletes, particularly those who are overtraining their abdominals. Now, you may be saying to yourself, I haven't been pregnant and I haven't been overtraining my abdominals, so why am I suffering with a diastasis recti? There are other common things that can lead to a diastasis recti, one of them being chronic constipation or chronic bloating. So if you have this chronic filling in your abdominal cavity, that too can stretch out the abdominal cavity and put increased stress on the rectus abdominis. Or you may be somebody who performs repetitive lifting for work or even with your daily activities, and that can cause a separation of these muscles as well, and that gap in the middle of your belly. Now, you may be saying to yourself, I was pregnant, but that was 5, 10, 15 years ago. Can a diastasis recti actually come on years after pregnancy? I would say chances are good that you had the diastasis recti after pregnancy. However, there are things that we can get away with when our bodies are younger that come to affect us as we get older. So chances are good if you're just noticing that now and maybe you're in your 50s, 60s, or 70s, that you may have actually had it after pregnancy. It's just your body was able to deal with it until now. And if you're a dude out there who's suffering with a diastasis recti and you're like, nope, I don't have the bloating, I don't have constipation issues, I will tell you that overtraining your abdominals can certainly lead to a diastasis recti. So how do you know if this is what's affecting you? You will see a visible ridge or a doming that is happening in your abdominal cavity. This is easiest to see when you're laying down on the ground or on your bed and you lift your head up. You'll see either that doming or you'll see that ridge. The other thing, when you're laying on your back and you lift your head up to look at your belly, is that you'll be able to see a gap between the muscles. So that's actually the ridge, right? So you have both of the muscles that are really tight. They're sticking up. They're creating that ridge in the center or gap, depending on how you want to talk about it. And most people who are suffering with a diastasis recti report that their core feels unstable. They just feel like they can't really hold it all together in order to be able to do their daily activities. So things like lifting your children, trying to do yoga or exercise, or even just trying to clean your house can become very difficult and potentially lead to other issues like low back or hip pain. And it is critically important to make sure that you treat a diastasis recti as soon as you realize you have one, because there are some long-term implications if you don't. The first one being pelvic instability. If you have been on the channel for a while, you know that I talk a lot about pelvic malalignment, and I believe that many women who are suffering with a pelvic malalignment are also suffering with a diastasis recti that happened after they were pregnant. The diastasis recti never got dealt with properly years ago, which leads to a pelvic malalignment issue now. And what that leads to is more of a hip pain, low back pain issue, maybe even sciatica, which is what brings them into my office. A diastasis recti that's not treated properly can also lead to pelvic floor dysfunction if left untreated. You see, the abdominals, the pelvic floor, and your low back are all what form the core. Now, I would also add the hip muscles into that when we're talking about the core. But for right now, we're going to talk about the fact that the abdominals, the pelvic floor, and the low back all have to work together. So if your abdominals are not working correctly, that's going to put increased stress on your pelvic floor, which can lead to things like incontinence and prolapse. Another thing that can happen with a diastasis recti that goes untreated is it's difficult to maintain that proper postural position, which can also affect your breathing. So again, on this channel, we often talk about the importance of posture to make sure that you're decreasing stress through your body. And we talk about the importance of deep breathing. If you're not having that abdominal tone that can support the posture, it makes that deep breathing more difficult and encourages that breathing up in here. You also are at an increased risk for a hernia if you are suffering with a diastasis recti that does not get treated. So a hernia is a prolapse through the abdominal wall. So many people are familiar with a pelvic floor prolapse, but you can have a prolapse that goes through the abdominal wall, and that is what's going to be called a hernia. If you're getting value from this video so far, please click that like button and don't forget to subscribe. We post videos every single week to give you tips on how to take care of your body. So now we're going to talk about what not to do if you believe that you're suffering from a diastasis recti. Okay, friends, I know this may sound counterintuitive, and it may be different than everything else you've heard on YouTube. However, if you are suffering with a diastasis recti, for right now, I need you to avoid all crunches and all sit-ups. If you do crunches or sit-ups, that's just going to encourage that abnormal movement pattern that caused the diastasis recti in the first place. So for right now, yes, I know you need to strengthen your abs. We're going to talk about that in just a second. However, for right now, I need you to avoid crunches and sit-ups until the diastasis recti is healed. Another thing that you need to avoid if you are suffering with a diastasis recti is planks or any weighted lifting of the leg that causes doming of the abdomen. Now, there are different degrees of diastasis recti. So some people can do a plank and they don't get that doming even though they may have a very small diastasis recti. If that's you, it's safe for you to continue planking for right now. Just keep an eye when you're in your plank position on your abdomen to make sure that it's not doing that doming, you're not seeing that ridge or that gap. And friends, whether or not you are suffering with the diastasis recti, please do not hold your breath while you're doing any straining movements. Now, this can include things like lifting, it can be weights at the gym, it can be lifting things around the house. It can also include holding your breath during bowel movements. We want to make sure that we are doing that nice breathing and not putting increased stress on that pelvic floor. And this one may be the hardest thing to avoid if you have a diastasis recti. You do not want to be sucking in your belly super hard. When you suck in your belly super hard, that reinforces that negative pattern for the muscles, and they start to think, this is okay, this is what this person wants us to do. We have to avoid that sucking in motion in order to heal the diastasis recti. All right, now that we're clear on what we are not going to do, let's talk about what we do want to do. So the first thing that we do want to do is make sure that we are actually massaging those muscles. So remember, they go from the sternum to the pubic symphysis, and they're two strappy muscles, one on each side. So what you're going to do is do gentle massaging motion all the way down those abdominals, and then you can go all the way down the other side. So one side and then the other. That will help to release the abdominals and any adhesions that are in them. Another thing that I'm going to encourage you to do is to work on your deep diaphragmatic breathing. We want to make sure that we are using that big muscle that is at the base of our rib cage in order to get that deep breath. We don't want to be using these muscles up here. One, it encourages us to stay in that fight or flight response, which is not what we want anyway. Two, it does not lead to proper activation of the abdominals and causes increased pressure in the abdominal cavity. Okay, now I told you earlier that you can't do sit-ups and you can't do crunches, so what can you do instead? We can start retraining those abdominals on how to work correctly. In order to do that, what we want to do is instead of thinking of pushing those abdominals back towards your low back, we want to think of lifting those abdominals up towards your shoulders. So I like to describe it as think about trying to put your belly button underneath your sternum. So your belly button, you know where that is. Your sternum is this bone right here that your ribs attach onto. So you want to think of lifting your abdominals as if you could put it underneath your sternum. Now I realize that you can't. However, that's the visual that I want you to put in your head while you try to do that contraction. We're not trying to flatten that arches low back, which can cause low back pain over time. We want to lift and get more support from those abdominals. It is important to focus on posture, alignment, and connection, and not just strength. If you're struggling with diastasis recti, you are not alone, and you can heal. If you liked this video, please drop us a comment below, and don't forget to subscribe for more content about movement is life.